also mentioned something about drug data, as
Uh-huh.
far as manipulation about what drugs do, what they are, side effects. So maybe you can shed some light.
Yeah. This is a big concept, and I'm going to explain it as quickly as I can. But a there is a statistical manipulation that happens in clinical trial research where you can either assess what is called the absolute risk reduction or the relative risk reduction. And the scariest example of how absolute risk reduction and relative risk reduction interact with each other is the first ever ads for Lipitor. And these ads for Lipitor, aka atorvastatin, aka the first of like the more potent statins. So it got hugely prescribed compared to predecessors of lovastatin and pravastatin. Tons of people are on Lipitor. Tons of your listeners right now are on Lipitor. The big clinical trial that got Lipitor approved showed that there was an absolute risk reduction in the two treatment groups. So, if you were in the Lipitor group, you had a 98% chance of not having the primary outcome, which was something bad. So, we don't want something bad to happen. So, 98% chance that nothing bad's going to happen. If you took placebo, you had a 97% chance that something bad was going to happen. Okay. So that's an absolute risk reduction of 98 minus 97, right? 1%. Okay. Technically, the number was 1.1%. But then what the drug companies do and what is commonly accepted in drug research is to take that absolute risk reduction and divide it by the baseline risk. Okay. So the placebo group had a 3% risk of something bad happening to them. The Lipitor group had a 98.1% chance. 1.1% over what's our baseline risk? 3% risk. People who took placebo, 97% of them, nothing bad happened. 3% had something bad happen. So if now we put that absolute risk reduction over the baseline and multiply out by 100, that all of a sudden magically turns into a 36% reduction. And relative risk reduction is always what is reported on the news. It is what is advertised in magazines. It is what makes direct to consumer advertising so dangerous. And you can even see it. You can go and Google it right now. Dr. Robert Jarvik, who got paid God only knows amount of money to put his name behind Lipitor. Lipitor reduces the risk of heart attack by 36%, is what the ad says. And then you read down below and it says, that means in a large clinical study, 1% of people 1% of people having a sugar pill had a heart attack compared to 2% on Lipitor. Wait, what? And so it is so dastardly what you can do with a simple statistical manipulation called absolute risk reduction versus relative risk reduction. And it is always what is reported in the media.
Yeah. So that can be, I don't even know how they could do that, frankly. It doesn't even make sense.
It doesn't. The argument is among statisticians that if you put it over the baseline risk, it estimates what is the actual risk within the larger population. That's the thought behind it. But then you just go, well, it's a 1% risk versus a 36% risk. Those two things sound dramatically different. And the two things are not equal. And it's something only people who have a very sophisticated understanding of drug knowledge really get. And it's frankly a lie. that gets perpetuated by the industry. And so it's one that I just stand up and say, no, we got to teach people this, and we got to teach it in a way that's understandable. So, one is just the absolute difference between the numbers. The next one, you're just dividing by the baseline risk and saying, oh, let's just multiply that and make it seem bigger than what it is.
Mm, yeah. So that's the main manipulation tactic from drug companies.
That's one, but then they also fund the studies, they pay the scientists. There's a revolving door between drug companies and the FDA. I mean, it's pathologic at this point, but I don't want to go down any kind of rabbit holes that people are like, oh no, this has gone down that rabbit hole. But the fact of the matter is, it is true. People who work for the FDA go back to work for big pharma, and vice versa, in a revolving door throughout careers. Drug research is primarily almost, it's what, 80%, 70% is all done in men. It's all done in male animals. And so there is an implicit gender bias in drug research. There is also an extraordinary racial bias in drug research, where we do not have adequate representation of people from different ethnic backgrounds, different racial backgrounds, to where we can actually see, like, blood pressure medicines are a great example. We know that in white people, ACE inhibiting drugs, in whites, Asians, Latinos, ACE inhibiting drugs are these amazing drugs that do great things according to the literature. African Americans are more at risk for very severe side effects that can be life-threatening with the ACE inhibiting drugs. And so it's much more likely to see a Black person on a calcium channel blocker versus an ACE inhibitor. And these subtleties need to be valued. They need to matter, because the individual taking that medication matters.
Mhm.
And so the statistical manipulation, I think, is the one that's most common in the media. But the layers of manipulation and outright destroying drug data, and I mean, look, the pharmaceutical industry has paid $80 billion in fines for lying on various reasons in just the past decade.
Mhm.
Just the past decade, $80 billion. And the list goes on and on about how big pharma values profit over patient care.
Yeah, I think that's probably one of the reasons that functional medicine has become more and more popular, is because more and more people have woken up to all these things you were talking about, not to the extent of, the breadth and depth of it, but they're becoming very suspicious, and they've seen a lot of problems. And they realize it's time to kind of take your health into your own hand, either treat yourself right with the right lifestyle, and also at the same time find an expert that can help interpret your health in a holistic manner and try to address some of the root causes instead of just reaching for that pill right away.
Mm-hmm.
So I think that's that's why I think this is a new medicine that's just brewing, has been growing tremendously. And whether or not traditional medicine entities, establishment, whether or not they admit that it's going on, it doesn't even matter. It's
Mm-hmm.
going on. And
Mm-hmm.
yeah, and you can see it from popularities of all these doctors who are talking about it.
Yeah.
It's on YouTube. People need information. They want it. They're so hungry for it. So
people are ready to take on their own health. And I think the era of our parents and grandparents who just did whatever the doctor said just because that was the institution is broken. And it's so great because it's breaking itself. We're not even doing it. It's just burning itself down over there and we're just going like, we've been trying to tell you for 10 years, but okay, catch up, come on. And so it's a beautiful, beautiful moment that we're living in where so many people just get it.
Yeah. Can't wait to hear, to see where medicine is in about 40, 50 years. It's going to be a whole different world, different way of practicing.
Yeah.
But the resistance is still strong. I still hear, doctors even blasting functional medicine on social media. So, but what this doctor doesn't know is that, wait until you're really sick with some kind of chronic illness, or your own family get really ill with chronic illnesses. Western medicine is fantastic at, surgeries, at acute conditions like infections, but for chronic conditions that has so many causes, it's not an acute impact, acute damage. It's not a bug that's attacking you. It's because of so many imbalances all over your body. That's why this traditional Western medicine is kind of at a loss. And that's what's been showing in the doctors, in their own practice. They're exhausted. Not only they don't have much time, but they're not making much impact on really helping these people living a better life. So that's what you're saying. It's breaking yourself down, from the doctor's level, even if they don't want to admit it, but just the way how they don't love medicine as much, how they're telling their kids not to go into medicine. I mean, all that's breaking itself down. So hopefully,
it's because we've lost the art of medicine, the actual, I mean, I think back to some of my first patients and just grieving by their bedsides, agonizing over what they were going through. Like, that's medicine. Laying hands on someone is medicine. Listening is medicine. But, I did a post on Instagram the other day. Air is medicine. Breath is medicine. Human connection is medicine. Eye contact is medicine. Movement is there's so much medicine. And I guess my bottom line here today is pharmaceuticals are not always medicine.